In the heart of southwestern Uganda, Mbarara University of Science and Technology, also known as MUST, stands as a beacon of education and healthcare. Its Department of Surgery has joined hands with Duke Global Neurosurgery and Neurology, DGNN, from the United States of America. For the last 10 years, the two have embarked on a transformative journey to change the face of neurosurgery in the region. Join me as we witness lives impacted.
While the division started in 2012, Duke joined us in 2017, and they have helped us in all the three major aspects of surgery, namely clinical services, research, and training of students. Under clinical services, we have had several camps, very useful critical surgical camps with the Duke doctors, and the most important thing for us conducting camps is for knowledge transfer to those who are who remain in Africa, and also to work on many of our patients where we may not have the expertise and the clinical and the equipment to conduct the operations. They have helped us to develop different specialized wards, for example, the high dependence ward.
We started this unit in 2000. In 2023, that was October, when we had a neurosurgery camp with a team from Duke, which was really successful. And we worked around 20 to 25 patients, and which was really a success. And I'm glad that every year we admit around 300 patients, and we have drastically reduced the mortality rate. And we thank God for that.
That word is very important to us because it is it's a step down from ICU, because there are many patients who do not qualify to be in ICU, and yet they won't be worked on well if they go to the general wards.
Duke has supported different neurosurgeons, different candidates to train as neurosurgeons in Mbarara, or get different training in neurosurgery. They might not graduate as neurosurgeons, but they get the component they would want to get as neurosurgeons. These include the undergraduate students from Mbarara University and neighboring universities, the Masters of Medicine students, the Masters of the fellowship students, Fellowship of Neurosurgery. But also this year, I'm excited to tell you that we are starting the Masters of Medicine Neurosurgery program. The Academic Register of Mbarara University has put out the advert already, and we're excited to have our first candidates in August this year.
I got an opportunity that immediately I was accepted as a medical officer in the division of neurosurgery in this very hospital under the scholarship of Duke University. Furthermore, I was privileged to join the neurosurgery path by starting with 2 years of membership under the College of Surgeons of East, Central, and Southern Africa. Then afterwards, I joined my fellowship program, and now in my second year, still I'm on the Duke University scholarship. This is really an opportunity for me because many people really may want to join this program, but it's very expensive. So as a resident, I've gotten opportunities for mentorship in the field of research, and also get an opportunity to be on the different papers with renowned people in the neurosurgery. And as a trainee, really I've been supported to attend different conferences locally and internationally by Duke University. And this has given me exposure in neurosurgery and has given me more connections with renowned people. Furthermore, here in Mbarara, we have gotten an opportunity, because we are quite a number of residents here, we have gotten an opportunity to provide neurosurgical services to the different Ugandans in southwestern Uganda, Uganda at large, and even our neighboring countries, whereby we provide trauma services, we provide oncology services, we also provide vascular services. It is good to note that Duke University has been key in the development of neurosurgery in this very hospital. For example, we are able to do now very complex surgeries involving the microscopes which have been provided to us by Duke University. We are able to carry out trauma surgeries with the sets which have been provided by Duke University, and also the consumables that we receive, because it is good to note that some of our patients may not really be able to afford these consumables, but we get these supplies from Duke University.
These camps bring essential, oftenly life-saving surgeries directly to those who desperately need them but cannot afford them. They are a testament to DGNN's profound dedication to health equity and community well-being.
Over the years, the Duke team has traveled to Uganda to carry out neurosurgeries in Mbarara. I want to use an example of a lady who could not walk but was able to get spine surgery that she wouldn't get as a Ugandan. The surgery would have costed a lot more, but if it wasn't for the camp, she wouldn't get the surgery because of the cost, but also the availability of the surgeons to give the surgery. So her alternative was to travel out of the country, but she couldn't afford that.
They have helped us to operationalize our theater. Right now we have one theater dedicated to neurosurgery alone, and they have helped us to equip the theater, to buy lights, to have theater tables, to have equipments which we use for the day-to-day work in theater, like bone drills and microscopes.
I give credit to Duke because they have really helped us to move on smoothly. We used to do one case or 2 cases per week, but right now we can do 11 cases, around 11 to 14 cases per week.
We receive patients from as far as northern Uganda. We receive patients from the neighboring countries coming here to receive neurosurgical services. The numbers are high, they are overwhelming, but it's comforting to know that we can do something about it. If you do not have a consultant neurosurgeon present, we are very comfortable knowing that a trained resident is able to take care of this patient. We couldn't do this if we didn't have a training program that is supported by the Duke program.
They support our outreach services, and we've been able to develop mobile endoscopic services for the management of hydrocephalus, because we've got the necessary equipment for us to do the mobile services. We are happy that we are working on a huge project together of Institute of Neuroscience, for which we are planning to have a building set up in this institution. Once that one is established, then of course both clinical services and training of students will have a major boost in that building. We have won research grants together. The one we are closing, we have already closed actually, the neurotube defect research. It's sponsored by NIH. And we have published a lot of research papers in peer-reviewed journals. The numbers are many. And also the volume of research. The volume of research has actually tremendously improved because of their collaboration. And we do impactful research to the community. Like the neurotube defect research will definitely change.
The DGNN Mbarara program has also created or established the epilepsy clinic, the neurology clinic. Before this started, all epilepsy patients were seen together with other psychiatric patients. And we know this contributes to the stigma that is related to epilepsy. We currently have a fully functional epilepsy clinic where adults are seen, children are seen, and any other neurological patient is reviewed by a consultant neurologist at our hospital.
Duke came in the picture and they took some of us. I was among the lucky ones to go and train as an EEG technician. So we went to Duke University where we trained for 6 months. Then later I was with Dr. Adrian Kayanja, who is a neurologist for adults, and Dr. Kalubi Peter, who is a neurologist for children. So when we came back, we started a specialized service for patients who have epilepsy and those suspected to be having epilepsy. So we started this clinic officially in 2019. Duke has been of so good service to us. One, they have trained us as specialists. Two, they have been supporting the clinic so much by providing payments for the staffs who work in the clinic. They have employed us a nurse, we have the data clerk, even the neurologists have been paid by the Duke University. All the staffs in this clinic are being supported by Duke University. Also, they provide us with some medications for patients, those that the government is not supplying for now. As we engage the government, if it comes in, well and good, but for now, since 2019, Duke has been supporting us with the medications. They also support us in the sensitization of these patients and the masses out there. We've been in the communities, we've gone to Rubindi, we've been to Mshanga to give support and sensitize the patients. Personally, I've been on radios and TVs sensitizing the masses about epilepsy, and also to some of the churches. We've gotten that opportunity and we've talked about epilepsy, all courtesy of Duke support. Thank you so much. We really appreciate the support Duke is providing on this service. The number of patients is increasing. We started with at the start we would see like 50 patients in a month, but now we are reaching 200 in a month.
We are really grateful. Thank you so much. Long live Duke.
Thank you very much.
Thank you so much. May God really bless you.
Thank you so much, Professor Hagland. Thank you so much, Beth. And thank you so much to everyone in the Duke program for all the support and efforts you're putting together to see that the lives of fellow Ugandans have been saved and have been improved through the work of your hands. May God bless you, and thank you so much.
We have moved from 4 neurosurgeons in 2012 to now 22 neurosurgeons in this short time because of their support in training neurosurgeons both locally here and abroad. I would like to thank them also for the clinical services. They have changed the face of neurosurgical services to our patients in this country. And because we have moved to one center, Mulago Hospital, and now several centers, 2 public hospitals and 1 private hospital. And the volume has changed, the depths of operations has also changed because of that training and because of the equipment they have given us. So to me, Professor Mitchell Hagaland and Professor Benjamin Waff are heroes to this country as far as neurosurgical services are concerned. I thank you. I thank you very much.
We at Mbarara University of Science and Technology are deeply grateful for DGNN's unwavering support. Their partnership is not just about funding, it's about building capacity, saving lives, and fostering a healthier, more hopeful future for countless individuals in our community. Together, we are making neurosurgery accessible and sustainable, ensuring that no one is left behind. Succeed, we must, for God and my country.